Hi everyone, Dr. Ernesto Medina here of the Bay Area Health and Wellness Center in San Jose, California. I wanted to talk to you about a few things we've been seeing with a lot of patients in the last couple months. We've been seeing a lot of people with chronic GI issues, chronic gut health issues, and digestive system issues. And symptoms can be anything from chronic bloating, chronic indigestion, heartburn, acid reflux, chronic diarrhea, chronic constipation, or alternating diarrhea and constipation together, even as severe as developing new food allergies that you once didn't have. And we've been seeing a lot of this in our office. And I want to walk you through kind of how we address this, how we evaluate this in a series of multiple videos because the digestive system can be very complex and comprehensive. And most of the patients we see that do come into our office oftentimes have seen GI specialists, have had very specific endoscopy tests, colonoscopy exams, which come back negative. They all come back normal. And patients, rightfully enough, come back very frustrated, not knowing what to do next. So let me break this down for you guys here. Like I said, we're going to talk about a little bit about gut health and digestive system function, what's normal and what's not normal. So all digestive function, which you need to understand, begins in the mouth. And from the mouth, um, it leads into the esophagus. From the esophagus, food travels down into the stomach. From the stomach, it travels into the small intestine. But in between the stomach and the small intestine, we have functions from the liver and the gallbladder and the pancreas that play a role in digestion. In the small intestine, we have digestion and absorption of nutrients that occurs, which then passes food into the large intestine, which is also known as the colon. And then we have poop. We have a bowel movement, which again, we should be having bowel movements anywhere between 1 to 3 a day. Um, any more than that and any less than that can be a problem, can be a sign of unhealthy digestive function or unhealthy movement of food through the intestines, which can lead to inflammation and bloating and all those things. Okay, and so just to get a little more specific here, in the stomach, we have, when food makes its way into the stomach, we have secretion of stomach acid. This acid should be very, very potent, very powerful. We have a saying that if you were to swallow a nail, that nail should be able to dissolve in the stomach acid that we have. That's how strong it has to be because it maintains the stomach sterile, right? If we eat bacteria or something not good to our system, the acidity of the stomach should be able to kill it and neutralize it so it doesn't cause an infection. That's an ideal situation. Okay, once that food gets mixed with acid, stomach acid, and food starts to digest, it dumps into the small intestine, which activates the liver and the gallbladder and the pancreas. Okay, the liver and the gallbladder both play a role in secreting bile. Bile is a more potent form of acid to help continue digestion of protein and fats in the small intestine. And the pancreas releases digestive enzymes. Those enzymes also help break down food, specifically carbohydrates, for better digestion, right? Um, from there, it goes on to the small intestine, large intestine, and we have a bowel movement. Right now, one of the most common things people complain about is chronic acid reflux or heartburn. All right, and the common explanation for that is, well, you're making too much acid. That's why you're getting burning up in the chest or the throat. But most often we find that is not the case. Most often it's the opposite. It's a problem of low stomach acidity, which is causing only partial digestion of foods you're eating. Because they don't fully digest, they then start to ferment and rot in the intestines. That fermentation creates gas that can make its way up through the esophagus, and that's the burning you feel. And more often than not, people get prescribed antacids, Prilosec, things like that. Those antacids neutralize your stomach acidity even further, which causes this never ending cycle of low stomach acidity, poor digestion fermentation of foods burning up into the chest and the esophagus. So more often than not, what we do is we take out inflammatory foods from a person's diet. We have to identify which ones those are because those can also contribute to heartburn. We take those foods out for 4 or 5 weeks. We work at improving and strengthening stomach acidity, healing and decreasing inflammation in the digestive tract, in the intestines and the gut, and making sure the liver and the pancreas and the gallbladder are working efficiently. That's how we address things like heartburn and GERD. Okay. Now, one other big thing that can be a contributor of acid reflux is a bacterial infection called H. pylori. Now, that's done through a breath test or a stool test to identify if that's the case. If that is the case, sometimes a course of antibiotics can help. But again, antibiotics do damage the healthy intestinal bacteria that we need to have. And we have also had cases of people who do a course of antibiotics after an H. pylori infection, and the heartburn goes away, but they still suffer from chronic bloating and indigestion type of symptoms. Okay, so I hope that helps shed a little bit of light. Our next video is going to dive deeper in depth into different issues that can happen in the stomach and different issues that can happen in the liver and the gallbladder. All right, thank you very much.